whenever, if a patient is asked about smoking, how many cigarettes do you smoke? Do you think anyone will have answers? How many vapes do you take in a day? You just take it unknowingly sometimes. Vaping has main constituent, which is nicotine, which is quite addictive. And then there are some flavoring agents which can cause asthma.
We're breathing in all this bad air anyway. Is there any point in doing yogic exercises while living in a metro city?
The type of air quality
Yeah.
we are now breathing. Probably it is maybe future we are going to oxygen parlors.
You can do a cardio in your air-conditioned room. But do not walk on the road below the bridge and
Yes.
consider it as good walking.
For a 60 kg person, his minimum intake of water should be 1800 to 2000 ml.
So 30 ml per kilo is broadly the indicator that we have to run.
Yes.
Your heart beats, your lungs breathe. But what if I told you that they're not just neighbors, they're teammates? Hi, I'm Jaggu, and in this episode of the Good Doctors Podcast by Zynova Shalby Hospital, we're getting into a powerful but often overlooked truth. Your heart health and your lung health are deeply connected. From asthma and sleep apnea to the air you breathe every day, your lungs could be silently influencing your heart's future. Joining me today are two eminent experts, Dr. Krishnarao Bhosale, cardiovascular and thoracic surgeon, and Dr. Tanvi, pulmonologist, who will break down this hidden relationship, bust some myths, and share what you can start doing right now to protect both your lungs and your heart. So take a deep breath and let's get into it. Doctors, welcome to the show. Thank you so much for taking out the time. Dr. Bhosale, welcome back. You've been with us before and it's a pleasure to have you
Right.
here.
Nice to be here.
Dr. Tanvi, thank you so much for taking out the time and doing this. Dr. Bhosale is now an expert as far as podcasts are concerned. So you have a high benchmark to meet.
Right.
But, on the subject of benchmarks, the heart and the lung, like we were just discussing, are important, vital organs that we end up looking at them independently, as it were. But more and more as you read and as we want to discuss in this particular conversation, there is a deep connection between them. Can you just go over it, Dr. Bhosale, explain it to us?
Yeah, I think we are right at the basics. And it is always good to understand the basics. See, we as human beings are gifted with these vital or spatial organs, heart and lungs. And as the nature has done good to us, they are well protected within our chest or a rib cage.
Sure.
If we see the actual position structurally in our body, they would be appreciable that heart lies right in the center, well covered by lungs, right and the left on either side. And when we talk of their functions, though we call them independent organs, well, the function is not independent, it's interdependent.
Sure.
See, when the heart has to do its function as a pump, it has two-chamber pump. One is what we call right side ventricle, and the other is left side ventricle. Here, we must understand the basics that when the pump acts or pumps out something, it has to receive.
Sure.
And on the right side, we have heart chamber called right atrium, which is a receiving chamber for blood which is deoxygenated or devoid of oxygen, as we put it, coming from the whole body. When it comes to right atrium, it moves to right ventricle, which is a pump.
Now, this is the blood that is circulated around the
Yes.
body, basically done a round and come back
Come
to
back.
to the heart.
Yes.
Okay.
It's a blood which is received back by the heart on the right side upper chamber.
Sure.
And when the blood, which is deoxygenated as we call it, is pumped by the right ventricle, it goes to lungs through its own artery or blood vessel which supplies both the lungs.
Sure.
See, here the interconnection is the right ventricle is responsible for creating perfusion of the lungs, where the deoxygenated blood moves through the lung tissue, lungs, what alveoli as we call it, which is the unit of lung function.
Fair.
Here, the important thing is when blood moves through the alveolar areas, it gets oxygenated and it also gives out carbon dioxide. So it's a dual gas exchange taking place in that part of the lung. This oxygenated blood, which is also devoid of carbon dioxide, is then collected to various blood vessels and has to come back to the heart, which is left side.
Okay, so it's gone from right to lung, now back to the left side
of the heart, where we have a receiving chamber. This receiving chamber we call left atrium. And so left atrium becomes a receiving chamber for oxygenated blood.
Sure.
This oxygenated blood comes to left ventricle, which pumps it out through the main artery, that is aorta of our heart, so it gets supplied to the whole of the body. So here if you see, heart cannot be said to work independently unless it receives blood.
Sure.
See, no pump can work without having received some volume of fluid in it.
Input, output.
Yes, it's in first and out then.
Fair.
So here the lungs play an important connection for oxygenation of the blood, and this oxygenated blood is essential to be pumped by the heart to the rest of the body for the metabolic activities.
So we've very clearly established the symbiotic relationship between the heart and the lung. The entire body is symbiotic in its own way, but this particularly so. Right. Almost siblings, as it were.
Yeah.
But so, Dr. Tanvi, let me come to the slightly bad news part of it. We think of heart illnesses and we think of lung illnesses, as it were. So we have cholesterol, we have high blood pressure, and we think of those as heart illnesses. But there are other issues like pulmonary functions or sleep apnea and things like that that affect the heart. Is that even possible? A problem with the lung is therefore affecting the heart simply because of the symbiotic nature of them?
So when the symbiosis, that is give and take relationship, is happening between the heart and the lungs, if the heart is not able to pump enough blood to the lungs and the lungs are not able to give good oxygen back to the heart, they are not going to give good to the body.
Sure.
So then when there are conditions of lungs, specifically if we see as the most common being asthma, it does have effect on the heart also. So if we observe the patients may develop devoid of oxygen. Later in those patients, when we see, I would just like to have the picture, sir, again. So mainly whenever any lung condition affects the heart, it is affecting the right part of the heart.
Okay.
Lungs will send everything back to this.
Sure.
If it is not able to send...
the right part being the receiving station.
The receiving station.
Yes, okay.
So if it is not able to send good oxygenated blood because of asthma, COPD, interstitial lung disease, lung fibrosis, any lung condition, the right part of the heart is going to increase in its wall thickness, which is called as the right ventricular hypertrophy.
Got it. Okay.
Then its pumping will be affected.
Sure.
You also know people say, I have BP issues. So
Yes.
that means it is systemic hypertension in our medical term.
Sure.
There is something called as pulmonary hypertension. Matlab lungs ka BP.
This is the first I'm hearing of this.
So, yes. So
okay,
when
so
you have...
pulmonary BP? Okay.
Pulmonary
Explain that one.
hypertension.
Okay.
So whenever there is hypertrophy of the right side of the heart, it may not be able to pump blood well to the lungs, and that causes increase in the blood pressure, which is called as pulmonary hypertension.
Got
So
it.
over the
Okay.
period of time when the patient is having a lot of breathing issues, be it any chronic respiratory conditions, right side of the heart gets affected, its thickness will increase, its function will decrease, and that may cause right ventricular failure. It may even the myocardium or the tissue of the heart
Sure.
may stop functioning. That can cause myocardial infarction. In simple terms, heart attack.
Okay.
So these things are very well associated with chronic respiratory conditions. Then when you have COPD, specifically in smokers or when exposed to pollution,
What is COPD?
it is chronic obstructive pulmonary disease.
This is an obstruction in the lung.
Obstruction in the lung
Okay.
due to constant exposure of smoke.
Okay.
And now we are seeing COPD very common because of the pollution also.
I wanted to get to that. We think of heart and lung diseases as more an internal issue, like a blockage or like the chronic obstruction that you made a reference to. But smokers, and that is a big fat red flag. But now we're also talking about vaping. It's the new trend last 5-6 years. And it's meant to be simpler than, better than in replacement of smoking. That can't be true.
So let me take you back to BDs. BDs
Yes.
were unfiltered cigarettes. Cigarettes are the ones which have filters, but still it has 4,000 carcinogens. It has 300 chemicals and causes numerous cancers. Then comes vaping. Vaping has main constituent which is nicotine, which is quite addictive. And then there are some flavoring agents which can cause asthma. So there are different flavoring agents. So you may want to do each of it many times to just get the good part of it.
Yeah.
Then you have a substance in the liquid form which is very toxic. We have formaldehyde, we have diacetyl, we have acrolein. Now one of it also causes some bad interstitial lung disease which is called as popcorn lung.
None of
Formalin.
this is sounding good, optimistic.
Okay, very simple way.
healthy at
Formalin
all.
is the one which we use to preserve tissues. When we take a
Oh.
biopsy of your any tissue, we use that to save the
Yes.
dead tissue.
Yes, I remember that
So
from...
such a bad thing, you're inhaling. When we used to do dissections, we used to double mask us up because we could not take that smell during dissection hours.
And now it's in the
And
vape.
now it's in the vape.
Wow. Okay. Okay.
And it comes with a flavor. That's why you cannot get the bad smell of it. You
Got it.
don't know that it is so bad.
Got it. Okay.
Other thing is, if a patient is asked about smoking, how many cigarettes do you smoke? Do you think anyone will have answers? How many vapes do you take in a day? You just take it unknowingly sometimes.
Yeah,
For
yeah,
the
now
cigarette
that you mention it.
you need a lighter, you need that amount, the number of cigarettes, you need to step out, see for the smoking zone.
Yeah.
For vape, you in your classroom, you can just do it behind. And
Yeah.
that's how today's generation kids are doing it.
How do we resolve that? Or what is the impact that those are having on lungs and heart?
So initially there was a thought that cancer will happen only to one who smoke. COPD will happen only to the one who is exposed to smoke or any pollutant at their occupation.
Yes.
So occupational asthma or occupational COPD.
Yes.
But that's not the case now. Indoor pollutants, outside air pollution, and also the construction work. So
Yes.
air pollution is different, and the construction, the particulate matter that we inhale because of the construction going on besides our house, opposite building. So all those things also act as pollutants, toxins to your lungs, and that is going to cause innumerable diseases of the lungs.
Fair
It
enough.
can be COPD, asthma, interstitial lung disease, lung cancer, fibrosis. We have a list.
Sometimes you don't pay attention to these things, or it's there somewhere at the back of your mind, but the construction is right there in your face and there's nothing you can do about it aside from maybe shut the window
So
or
there
put
is
some
a
sort of air
condition-
purifier.
So there's a condition called as bronchiolitis. We used to see that only in children. Okay, respiratory bronchiolitis. It may be due to any viral infection in children. But now we are seeing that obliterative bronchiolitis, infectious bronchiolitis, which has become very common. So bronchiolitis मतलब हमको पता था कि asthma or COPD affects the larger airways. Bronchioles are the smaller airways, which
Sure.
then goes to the alveoli. So infection of all those small parts are also becoming much popular, much commoner, because the particle size which is reaching the lungs has increased.
Sure.
More and more, we are more and more exposed to little small particles. The amount of exposure, the hours of exposure, the proximity of exposure, everything has increased, and because of which this bronchiolitis has also become very common.
This city living, as convenient as it can be sometimes, is also a scary proposition.
So out of 9 of 10 people living in urban areas, they may have some of the other effects because of the pollution.
I can imagine. We're reading and hearing so much more about that, including in our own circles, as it were. But what can be done in terms of, simply put, breathing more oxygen?
Improving lung function.
Yes.
I think that is the question.
Yeah.
See, when we talk of improving the lung function, see, a lung has two basic requirements. It needs to be ventilated. That means we have to take in air and breathe out air. That is one aspect. That is what we call respiration.
Sure.
And the phases of respiration, inspiration, expiration, and the pause in between, allows stay of air in the alveoli for adequate period of time so that the gas exchange can take place. Second aspect of lung function is perfusion. That is, it must get adequate blood supply to the alveolar capillaries, the small vessels of the alveoli, so that the volume of blood has adequate gas exchange.
And what can be done to help this process
Yes,
along?
I am coming on these basics. I am coming to that. See, how to improve ventilation. See, what breathing exercises we talk, they are improving ventilation. And when we say improving ventilation, it is both inspiration and expiration.
Both
That is,
elements.
inhaling air in adequate volume with adequate pressure. See, these are very important aspects. And exhaling air with adequate volume and adequate pressure. I think that is the basis of almost all breathing exercises.
True.
Same thing of perfusion. The lung must get adequate perfusion. So there are ways to improve lung perfusion. Say when we do leg highs, there is good return coming to the lungs.
Sure.
So these are ways to improve the perfusion to the lungs.
Fair.
I think the actual practical aspect of these breathing exercises, Dr. Tanvi will be able to elucidate a little more.
Dr. Tanvi, I was coming to you with that as well as the added complication. Now, this is layman conversation, so clarify this for us. The exercises that one would do, or literally the kind of lifestyle one would lead to improve oxygenation, breathing, all of that. But also the layman conversation is, but what is the point? We're breathing in all this bad air anyway. If you take a deeper breath, you're taking in more particulate matter. That sounds right and wrong at the same time. Can you just clarify that for us? Is there any point in doing yogic exercises while living in a metro city, for example?
So in winters, we do not advise patients to go outside for walks in morning. We do advise go at 4 p.m. or do indoor exercises to prevent all winter bronchitis.
Sure.
So make sure it is better air and do your exercises. See, what happens is after the age of 50, your lung function is anyways going to decline. You have to match up with that. So once you start doing breathing exercises, you match up with that and all breathing complications will be reduced.
Okay.
Very simple way, how I explain my patients, lungs also have elastic tissue. The way you have muscles, the same way you have elastic tissue. You do exercises daily, your muscle is going to build up. How do? You don't do this. You do it, you hold, and then you put the dumbbell down. Same way, inhale, hold, and then exhale.
Okay.
When you're exhaling, when you're doing exhaling exercises for obstructive diseases like COPD, asthma, inhale a little, exhale longer. Focus on exhalation.
Got it.
What is COPD, asthma? Bad air trapped inside. Just release that well. 15 seconds of prolonged exhalation, what we call as pursed lip breathing. So whatever sir has explained the basics, there are various breathing exercises. The principle remains the same. We have pursed lip breathing, we have diaphragmatic breathing, we have box breathing, we have 4, 7, 8 technique. I may explain them later.
Yes, yeah, but I mean, to get the basis right,
That was the basic, yes.
Adding to what Dr. Bhosale was saying in terms of there needs to be a conscious process of breathing so that there is the air exchange, there is the flow, all of that. And that's exactly what you're elaborating on.
So first is improve oxygenation. Second is improve your lung capacity.
Yes.
Only getting good oxygen, but your lungs are weaker. It cannot do the good pumping. So that's not the use. And after all this, when you do all this, you improve your cardio, you improve your exercise capacity. All those helps in improving your heart.
Fair.
So your heart functioning will be better. Your heart diseases will be reduced. So this is how the lungs exercises will help the heart. It will help regulate the rhythm of the heart. It will help regulate the flow of the heart.
That makes sense.
If an individual realizes that at end of second staircase I am breathless,
Yes.
my chest is becoming little solid, I am feeling grip in the chest, or my heartbeats are becoming too obvious for me to appreciate them. That is
Yeah.
what we call palpitation.
Yes.
Well, that is an indicator one should take seriously and seek a medical attention.
No, that's fair because I mean the heart is beating all the time. But
Yeah.
if I'm suddenly conscious of it, that could be an indicator or an early warning sign.
Consciousness of your heartbeats with breathlessness at the accustomed exertion level.
Yes.
Well, these are
No
very clear indicators of cardiac.
issues.
Yes.
Okay. So,
So
Dr.
we are
Tanvi,
saying actually both the symptoms together. If we say chest pain and breathlessness, they can be overlapping in both cardiac and respiratory conditions.
sure.
Chest pain in asthma will be entire chest feeling tight. Same can happen in myocardial infarction also. Maybe sometimes more on the right side in 50% of the patients, but chest pain can be both in cardiac and respiratory issues. Breathlessness also can be both in cardiac and respiratory issues. Only sometimes wheezing may help more in diagnosing respiratory
Yes,
conditions, but
yes.
if you know of cardiac asthma,
Yes.
cardiac asthma also has wheeze.
Wow.
So
Okay.
that is
That's
left ventricular failure, left side of the heart having breathing problems,
Yeah.
having problems, that is cardiac asthma. Right
Got
side
it.
of the heart or chest having problems is actually asthma.
Okay. This is going to take some computation and just it's good to know because then at least we're aware what to look out for. No, absolutely. On the prevention side, I want to explore something else with you. We do cholesterol checks, we do blood pressure checks fairly regularly. I mean, we even know our numbers. But for the lungs, lung function test, biomarkers, is that recommended as regularly as we do, say, a cholesterol or a BP check?
Yes, so now in all health checkups also pulmonary function test is included. What we don't include is a low dose CT scan of the patient where we see changes of COPD, early COPD, because we are too much exposed to the pollution, passive smoke. But spirometry or PFT, pulmonary function test, is a very good predictor of the lung functions, and it will also help us diagnose all heart conditions also concomitant with it.
Fair. Let me give you another example. Sleep apnea. We think of it as a breathing problem, lung problem, as it were, and it creates its own complications, but it then proceeds to affect the heart also, doesn't it?
Yes.
How does
And
that...
the brain also sometimes, yes.
Oh, good Lord.
So
How
sleep
does-
apnea is basically divided into two types: obstructive, which is because of obstruction in entire airway somewhere. Second is central sleep apnea, because of the brain not sending signals to the lungs to take a breath. So there are two types. First of all, the central sleep apnea will have a lot of neurological issues also.
Sure. Yes.
Now, obstructive sleep apnea, mainly it is in obese patients where there's obstruction to the passage. The way we have fat outside, the same way we will have fat inside, because of which we are not able to take breath. Any cessation of breath for 10 seconds in the night, because of which there is drop in oxygen levels, is called as apnea.
Okay.
So now what are the symptoms that patients will come to us
Yes.
with? Mainly there will be snoring as the most important symptom. The spouse will say that the patient suddenly has choking episode or doesn't breathe and then gets up and again takes a breath. So that is called as witnessed apnea or choking. Then again, morning when the patient gets up, there is headache,
Fogginess.
not able to concentrate at work, tendency to fall asleep wherever the patient is sitting, lousy, driving, sitting in a waiting area. So that is called as daytime hypersomnolence.
Okay. Which is a direct consequence of sleep apnea.
Yes. So you're not able to function well during the night because you have not slept well during the sorry.
Fair.
So
During the
because of
you sleep
which-
in the day because you've not slept well in the night.
well in the night.
Okay.
And what exactly happens inside is your oxygen levels are going down because you're not breathing, your BP is shooting up, your heart rate is shooting up, your sugars are shooting up. So this is how just level of oxygen drop is affecting your entire body, mainly cardiac because there's shoot up of heart rate and blood pressure. But
Yes.
when the oxygen level dips down to such a level like below 50% or something, there is a risk of sudden cardiac death. Why we say that all sleep apnea should be treated, should be diagnosed, because a person gone in sleep, an obese person gone in sleep is mostly because of sudden cardiac death due to sleep apnea.
So I want to ask you this again from a layperson point of view. Person A has sleep apnea. He's put on weight recently. All he needs to do is lose weight and the sleep apnea will go. But that's not the only solution, or sometimes weight is not the only reason that sleep apnea happens. Is that not right?
Yes, sometimes weight is not only the reason, there are anatomical problems. The jaw of the patient is small, the jaw is placed a little inside, the tongue is larger. So there are many anatomical reasons also because of which sleep apnea can occur. They need to be treated with the positive pressure mask or by an ENT person anatomically with surgeries.
Okay.
But at the same time, if sleep apnea will be diagnosed by a polysomnography or sleep study test. So if you diagnose that, there are 3 levels again, mild, moderate and severe. If it is mild, lifestyle exchange is the only treatment. We motivate the patients, we make them understand that every 4 kgs drop in their weight is going to improve their sleep apnea score.
I see. Okay. So let me, Dr. Tanvi, come to you with treatments, rehabs, any new movement. So pulmonary rehab is usually prescribed for lung disease ailments, but it can also benefit people with a heart issue. How does that work?
I would like to give a very simple example. When an asthma patient walks in my OPD, his oxygen levels are 92%. I don't apply oxygen mask immediately. I see the pulse oxygen, the SpO2 meter, it has low oxygen and it has heart rate which is above 100. What I simply ask is take a deep breath and exhale as long as possible. That is called as pursed lip breathing. With that, within 3 minutes, I see that the oxygen levels improve and the heart rate goes down. This is how you see that symbiotic relationship we have studied, but they do take care of each other also.
Yeah,
So
yeah.
the same way, on a very simple example which I have given, I would like to explain when we teach breathing exercises, why it has to be done with a physiotherapist. Because she will also take care of your heart rate.
Got it.
You cannot just keep on doing breathing exercises, but your heart rate is going haywire.
Which you don't
The
know.
same way
Yeah.
you cannot keep on doing just cardio when you are having an asthma attack or a wheezing in the chest. So it has to be monitored well. You have to do exercise only which you can do, which you are able to do comfortably.
Sure. Fair. Dr. Bhosale, let me ask you this. In terms of, there's always medical developments. What is ECMO? I keep hearing about ECMO in terms of a treatment. And is it for heart and lungs or just cardiac issues? What is that exactly?
ECMO is a recent technology advance which is in use even in India. In fact, we all have gone through COVID times. And it was during COVID times, this technology has benefited many patients for lung support.
Okay.
It is a technology which benefits both heart and lung patients when they are in a what we call end stage deficiency of function of lung or function of heart.
Okay. So fairly
Uh,
serious stages then.
Yes.
Okay.
So this technology is used only at very advanced stage of heart or lung disease.
So, in a simple way, when the ventilator actually fails, the ventilator is not working.
Oh, we're beyond ventilator.
Yeah, this
Yes.
is beyond ventilator.
Okay.
And the treatment is only lung transplant, but the patient's body is not fit for lung transplant. There's something called as ECMO, which steps in.
Okay.
See, in this technology, it is like supporting function of the heart and lung both outside body.
Okay. Okay.
See,
Fair enough.
we have a special system of oxygenator and pumps.
But now we're talking ICU level treatment.
Oh, this is always ICU level.
Okay. Fair enough. And it's for end stage.
Yes.
Okay.
So,
it's not a precautionary,
This
it's
is-
not an early stage. None of
yes,
that doesn't
no.
come into play then.
Yeah.
Okay. Fair enough.
And it's not a permanent solution. Permanent solution
I-
become a
it's
cardiac
a-
transplant
it's a-
or a lung transplant, but right now the patient is not fit.
I
So that's
see.
why.
This is a bridge to various further modalities of treatment
To a more long
to
lasting solution.
salvage the life.
Okay. So now, Dr. Tanvi, at the other end of the spectrum, salt therapy or stuff like that, are these wellness trends or are they actually good? Are they actually good for the lungs?
So salt therapy, also called as halotherapy, it was first invented in Poland, Eastern Europe, and back to the 12th century. There they saw that the salt miners were doing much better with respiratory issues as compared to other people. It became favorite destination tourist spots also later. But when we apply that knowledge here, it doesn't really work the same way.
Is that right?
There's no research on it, first of all.
Okay.
Other thing is what we do as pulmonologists, we have 3 different concentrations of salt which we use at treatment when the patients require. One is 0.9%, which is normal saline. One is 3% and one is 7%. So we know exactly which patient will require how much concentration at what time.
So
If there
what
is someone opening a salt spa, he doesn't know what various lung conditions are and what the treatment patient exactly requires.
Okay.
When does a patient require salt therapy? If there is thick mucus. Mucus is if there is any allergen or toxin going inside, that's a barrier that your body makes, mucus plug. It traps all the toxin and throws it out as a cough in the form of phlegm.
Sure.
So it's a normal thing which it is doing. Sometimes the mucus becomes very thick. It can be because of the cold winter. It can be in serious asthma patients who have fungal hypersensitivity, where we specifically see that the mucus is thick. So in those patients, we do prescribe saline nebulizations to get that out.
Okay.
If the problem is in nose, very frequently we advise patients like kids to take saline treatment of just saline drops. So we are already treating it. The doctors know when and which patient to treat how.
Okay.
Salt cave is not the solution.
But it's not something one does at home.
Yeah.
One does it under supervision.
Yes.
So then let me come to something even simpler, steam inhalation. Is there, we're used to doing steam inhalation when you have a cough, cold, congestion and all of that. There's enough people saying, I don't know whether it's a medical thing, but it's certainly a wellness thing, but well, you know what, do it every day irrespective of how you're feeling. Is there some medical truth in being able to do that?
So whenever there is mucus clogging inside, you need to do.
Okay.
Whether it is in nose or in the chest, you do it and you will feel better.
Sure.
There is no need to do it every day.
There is no long-term
Benefit.
from doing
No.
it every day for decades. That doesn't. Okay. So you keep hearing these terms like ECMO, salt therapy, steam inhalation. Okay, we all know, but then suddenly people are finding newer uses for it. if it were. And then
If
it's
you're
always
going to
good to have
put
medical
10
clarity.
minutes of steam, I would prefer that patients should do 10 minutes of breathing exercises.
Fair enough.
That would help them much better.
And then again, supervised breathing, or at least get a sense of
Yes, just
what
get the
type
sense
of
of
breathing
what.
you should be doing.
Yes.
Fair enough. You know, let me, as we come towards the end of the podcast, actionable steps. We've understood the basics. We've understood the problems. We've understood the symbiotic nature of the lung and the heart, and also some things that we keep hearing about, but we should not be focusing on. You know, it takes away from the main issue. But now let me come to actionable steps, as it were. Small changes, powerful changes that one can do, whether it's lifestyle or even if it is medically assisted. But what can be done just for longevity reasons and for health reasons? And I'll ask both of you all to answer that question.
I think before I answer that question again, one concept of oxygen parlor, which is in vogue in many countries now. Probably the type of air quality we are now facing, we are now breathing. Probably it is maybe future we are going to have
It could
oxygen
happen.
parlors.
It could happen.
Oxygen parlors. Just go get your blood enriched with oxygen and move out of that parlor.
So this is not a fad then.
It's not.
You're saying you're recommending that this is something to do.
Issue. It's a serious issue.
Okay.
Yeah, because if your air quality is so bad, obviously your body needs oxygen enrichment.
How often? With what level of regularity should one be doing
I think
this?
that question I don't think anybody is able to answer today.
Okay.
Probably as we go with the parlor concept, oxygen parlor concept, and we see the results, we'll be able to comment on that.
Okay. Now,
It has to be research-based because there are some conditions in lungs like COPD where giving oxygen beyond a level is going to be harmful for the patient.
I see.
When your oxygen levels are down, you may breathe, you may take efforts. When you provide good oxygen to the patient stops breathing. That is where carbon dioxide increases. We call it as CO2 narcosis.
Okay.
And the patient becomes drowsy when the patient has to be put on ventilator.
Oh, you're saying this is too much carbon dioxide in the
Too
body.
much oxygen causing lesser efforts from the patient side, causing too much carbon dioxide.
I see.
So we are giving problems to the patient by giving more oxygen.
Understood. So it needs to be calibrated.
Yes.
If you're taking
so
oxygen,
everyone
it needs to be
need not have 100% oxygen every time.
Sure.
So for conditions like COPD, having 90 to 95% oxygen is good enough.
Is fair enough. Fair enough. So then, Dr. Bhosale, let me come to you with this. Up until the point where we have oxygen parlors, what is that one thing that we can do up until then as an actionable step just to improve lifestyle?
I think lifestyle, physical activity, breathing exercise properly done, and preventing or keeping away from the polluted air. I think this is what we need to consider so far as the lung illnesses are concerned.
Okay. Now, there are two issues I want to discuss, and you've pretty much touched upon it, and we've also discussed it over a period of time. In metro cities, we live in heightened levels of pollution. It's right outside our door, right outside our window. Shutting the window is not a solution. Is air filters a solution? Is some sort of purification method a solution? Are those, I forget the names, but those plants that one puts, that indoor plants that says, they're releasing oxygen all the time. Are those even solutions that we can use?
Indoor plants can be added. Second is air purifier can be added. But whenever you're purifying your inside environment.
Yes.
That is helpful if the patient is there.
I'm saying not even
home.
patient.
No. So if there is a patient who is staying at home, who's not going outside, who is on oxygen, it's helpful for the patient.
Okay.
But if you're staying with air purifier and plants at home, and if you're stepping outside, walking across the road between all the construction sites, that is not going to be helpful.
Okay.
So you have to mask yourself up, put a scarf, handkerchief, something whenever you're going out to prevent yourself from tuberculosis, which is much there in India,
Yes.
from other viral infections, because our immunity post-COVID has become very low to get any to heal from any viral infection. And third is from the pollutants.
Yes.
Third is swimming exercises I will recommend, which is best for the lungs
Okay.
for and improving the overall exercise capacity also. And
Fair.
fourth will be breathing exercises for 15 to 20 minutes every day.
Okay. And if one goes for a walk, as one does, especially right after New Year's, where everybody has decided, okay, now we
Yeah.
must get our health better, the location that you're doing the walk in is
Yes,
important,
yes,
right?
Yes.
Okay, fair enough. So closer to the seaside or closer
There are only few patients who have problems because of the humidity, they get asthma.
That's a separate issue.
So
Yeah.
then they can avoid seaside. Otherwise, seaside is not a problem. It has to be between some good greenery in the surrounding, or that you can do a cardio in your air-conditioned room. But do not walk on the road below the bridge and
Yes.
consider that as good walking.
Fair enough. No, I understand that. Dr. Bhosale, let me address another matter with you. From a cardiac perspective as well as a pulmonary perspective, hydration. We invariably do not hydrate ourselves enough, but it's not just a question of now I'm feeling thirsty, I'm not feeling thirsty. This has long-term effects.
It has. No, it has. See, ultimately, hydration means water adequacy. And see, water in our body forms 2/3 of our weight.
Sure.
It is present everywhere in every cell, and it is in what we call equilibrium, with the circulating blood. So when we talk of hydration, which is a very essential vehicle, water is a very essential vehicle which takes all your electrolytes, minerals, vitamins, hormones, proteins, everything, energy substrates to every cell of our body. It also carries the metabolic toxins within, so that kidneys can filter them out and eliminate from our body. So it's both ways. You must have adequate volume to carry your essentials, and you have adequate volume to carry back the metabolic toxins,
Yes.
so that the kidneys get adequate volume to filter them out. That is one part. Second thing is water in blood, what we call a plasma component, is essential to maintain viscosity of blood, so that it is not just the volume. The blood has to flow with pressure.
Sure.
A very dilute blood always has hypotension or less pressure. Whereas when you are dehydrated, that hemoconcentrated blood will also have similar.
I see.
So to have adequate volume with adequate pressure flowing through the circulations is the base for keeping ourselves hydrated adequately.
Doctor, you're using the word adequate, but
Yeah.
it's
Yeah,
not a one
coming-
size fits all strategy.
No. Then I'll put it further in a
yes.
scientific way.
Yes.
See, if I have a patient or a person who is 60 kg weight, we expect him to pass out through the kidney filtration at least 1200 ml of urine.
Okay.
Plus, there is always a insensible loss. So, around 600 ml, which is 10 ml per kg, and other is 20 ml per kg. So, the intake of that individual has to be above 30 ml per kg.
Above 30
So,
ml per kg.
so
Okay.
for a 60 kg person, his minimum intake of water should be 1800 to 2000 ml.
Okay. This is true for males, females across
Yeah,
the board?
it is taken for both, same.
Okay. So 30 ml per kilo is broadly the indicator that we have to run.
Yes, that is the minimum you should consume
Or in
or take.
simplified term, we can say every 20 kgs, 1 liter of water should be consumed. Because we do have patients weighing up to 100.
That's a lot of water I'll have to consume is what I'm worried about.
We need to be careful in cardiac. That
Yes.
has to be cardiac and kidney issues, whatever the doctor prescribes.
I want to ask you this because it comes up in argument sometimes. Is there something as too much hydration?
Yes,
Yeah?
when the blood volume exceeds more than 10% of your circulating blood volume,
Okay.
that becomes loading, volume loading.
Okay.
And this volume loading is not good for heart, for lungs, and even other body tissues. Because,
Okay.
see, you are putting the volume in circulation. The volume coming to the heart is more. The ventricles, the contracting part of the heart, has to contract against higher volume, higher pressure. The lungs tend to accumulate fluid, what we call pulmonary edema like situation, which is detrimental to gas exchange.
Fair enough.
So heart function deteriorates, lung function deteriorates. There is fullness of body tissues due to water accumulation. So all these things are problems with high volume.
So the word adequate is very important here.
Yes.
Not too much, not too little.
Yes.
Broadly, every 20 kilos, 1 liter of water is the thumb rule to go with. Okay. Now, I know I might be repeating myself, but as we close this podcast, from each of y'all, I want one actionable step that a person can do as a precaution, as a health measure, to take care of heart as well as lung together. If I can ask y'all to address that
I think
independently.
we have discussed the importance of two important parts. One is physical activity,
Yes.
and other is breathing exercises in non-polluted air.
Absolutely. And Dr. Tanvi, are you in sync with that? Or would you like to add to
Yes.
that? Okay.
Definitely.
So exercises
So,
and breathing.
People have already, like always, doctors say that 30 minutes of walking will help you with all your health problems. Now, I would like to add, because we are staying in such an area, in such a surrounding which has a lot of pollution, and our own body is not that healthier, which earlier it used to be. So, breathing exercise is mandatory. 30 minutes of walking or any cardio plus 15 minutes at least of breathing exercise daily for one who is smoker, non-smoker, baby, kids, everyone.
This is very enlightening. It's not an either or situation. Lifestyles and literally stuff that we cannot deal with in terms of the environment outside has gotten to a point where it's 30 minutes exercise plus 15 minutes breathing is a better option than just either one of the two.
If you have any lung issues, better do a pulmonary function test, know whether you have obstructive issues, restrictive issues, and do those exercises.
Got it.
If you have upper respiratory tract problems like rhinitis, sinusitis, do anulom vilom. That will help you more.
Yes.
If you have just breathing issues, cardiac issues, do pranayam. That will help lower your blood pressure. That will help regulate your heart rhythm. And if you have obstructive issues, exhalation exercise. Blow balloons, blow candles, blow those foldable pillows. Do all sorts of blowing exercises.
That's interesting.
But do something which is very comfortable at home. You're watching your YouTube and just doing a 3-ball spirometer exercise up and down, turn it upside, blow in it. So do something very simple, but do it for 10 to 15 minutes every day.
I very much appreciate that you broke it down for me. It's like breathing exercises, like I can come up with a bunch. I don't know whether they're good for me or not. But the fact that you've broken it down and that you've added the elements of both exercise and breathing, I very much appreciate that. And also appreciate all the input and all the knowledge that we've gotten today. So Dr. Bhosale, Dr. Tanvi, thank you so much for your time, for your knowledge, and for sharing it with us. Very much appreciated.
Thank you.
Thank
Thank
you.
you very much.
What we often treat as two separate systems are actually deeply in sync. And the smallest habits can make the biggest difference. A huge thank you to Dr. Bhosale and Dr. Tanvi for unpacking this vital connection. If this episode made you think twice about your breath or your heartbeat, don't keep it to yourself. Share it with someone you care about. See you in the next episode. In the heart of Mumbai stands a name trusted by thousands. Over 1 lakh heart procedures, 200 plus years of combined experience. From diagnosis to recovery, your heart gets complete care under one roof. Because when it comes to your heart, experience isn't optional, it's everything. Zynova Shalby Hospitals. Experience you can trust, care that you deserve.